Okay, good morning everyone. How are you today? Okay, I'm fine too, thank you. Before we start the class, let's pray first, and the captain class can lead us. Okay? Okay. Okay. Thank you. Anyway, who is absent today? Oh, nobody. So all of you are present today. That's great. Okay, I wanna ask first. Have you ever feel dizzy when you move from squat position to stand up position? Who is that? I hear someone answer it. Okay, Ginny. Okay, so Ginny's feeling is related to our topic today. Guess what? Yes, Jan? Oh, blood tension. Mm, it's too specific, but some materials are related to blood tension. Okay, who else? Jack. Ah, okay, Jack. Wait, what? Oh, blood disorder. That's right, Jack. So, today we will talk about blood disorders in circulatory system. But first, let me show you a video. So let's check it first.
The cardiovascular system is divided into systemic and pulmonary parts. The systemic circulation carries blood from the heart to tissues of the body and then returns it to the heart. Oxygen-rich blood is pumped from the left ventricle into the ascending aorta. The aorta then makes an inverted U-turn to form the aortic arch, which gives rise to branches that supply the head, neck, and upper limbs. The aorta continues posterior to the heart as the descending aorta, which travels through the thoracic and abdominal pelvic cavities. It supplies the organs of these cavities and the lower limbs. In the systemic capillaries, oxygen is exchanged for carbon dioxide, resulting in oxygen-poor blood.
Okay, first is systemic circulation. It starts with left ventricle that pump blood which contain oxygen that's in the red one and delivered to aorta, then to whole body by artery until reach capillary. And the capillary you can see the small branch here. That's the capillary, and the capillary do contraction and relaxation alternately, called vasomotion. So blood flow intermittent. They are exchange of substance through the capillary walls, which only consists of a single layer of endothelial cells. The tip of the capillary that carries oxygenated blood are called arterioles, while the end of the capillaries carrying the oxygenated blood are called venules. And there is a connection between the arteriole and venule, which shape like sorry, which shape like a webbing. There is also a direct connection from the arteriole to the venule via an arteriovenous anastomosis. Blood from the arterioles and venule capillary flows to venule, then to the large veins, vena cava superior and vena cava inferior. The vena cava superior in the above and the inferior is in the under the heart, and back to the right heart or right atrium. Blood from the right atrium next enters the right ventricle through the tricuspid valve.
The oxygen-poor blood enters the right atrium via the superior and inferior venae cavae. The pulmonary circulation carries blood from the heart to the lungs for gas exchange and then returns it to the heart. Oxygen-poor blood is pumped from the right ventricle into the pulmonary trunk. The large pulmonary trunk divides into the right and left pulmonary arteries. These arteries transport blood to the right and left lungs. In pulmonary capillaries, carbon dioxide is exchanged for oxygen. This results in oxygen-rich blood that then flows through the 4 pulmonary veins and enters the left atrium.
Okay, so in the pulmonary circulation begin with when the oxygenated blood or from all over of the body, the blue one, which drains through the superior vena cava and vena cava inferior to the right atrium, and then to the right ventricle, leaves the right heart via the pulmonary artery to the lungs. In the lungs, blood flows into the pulmonary capillaries when exchange takes place substance and fluids, thereby producing oxygenated blood, and oxygen is taken off breathing air. This oxygenated blood is then passed through the pulmonary veins in the right and left, leading to the left atrium, and then entering the left ventricle through the mitral or bicuspid valve. And blood from the left ventricle then enters the aorta to be flowed throughout the body, and the circulation begin again. Okay. Okay, now based on today's topic, please finish the worksheet. I will share it on WhatsApp group, so now you can join with your groups. A groups consists of 3 to 4 people. You can do it on Google Docs directly, and I will give you some module and article, so maybe it can help you to do the worksheet. And after you finish the worksheet, you can present it, and I will ask you randomly. Okay. By the way, can you access the worksheet? Okay. You must finish it in 20 minutes. Okay. Okay, good luck. Okay guys, time's up. Stop working, and now I will choose you randomly. Okay. First I will choose with that Rasi. Please answer to number 1A about what is hypotension. Okay. Okay, thank you, Rasi. So Rasi is right. Hypotension is a decrease in systemic blood pressure below accepted low values, while there is not an accepted standard hypotensive value. The pressure is less than 90 or 60 are recognized as hypotensive. Hypotension is relatively big condition that's under-recognized mainly because it is typically asymptomatic. It only becomes a concern once pumping pressure is not sufficient to perfuse key organs with oxygenated blood. This leads to symptoms impacting the quality life of a patient. Okay, thank you, Rasi. And next, number 1B, please, Sergio. What causes hypotension? Okay, that's right, Sergio. The hypotension caused by emotional stress, fear, insecurity, or pain. And next is dehydration, which reduces blood volume, and then the body's reaction to heat, which is to send blood into the vessel of the skin, leading to dehydration. And next is blood donation. It's which reduce some blood volumes because our blood is thick to the other person. And then internal bleeding, such as perforated stomach ulcer and blood loss from trauma, such a road accident or deep cut. And the next is who else? Oh, Gianardi maybe. Please, you can answer number 1C. How treatments for the patient of hypertension? Okay, that's right. For hypotension, you can use stocking compression, the or Carmen compression. It's same, I think. The rationale for using graduate compression Carmen is to apply external counter pressure to the lower limbs or abdomen with the effect of reducing venous pooling and capillary filtration, resulting in increased venous return. Short-term improvement in orthostatic blood pressure with garments applying counter pressures to lower limbs have been demonstrated. Garments that compress the abdomen have shown greater promise in attenuation blood pressure reduction. Okay, to give you more material about hypotension, let's check the video first.
What is hypotension? Hypotension is a decrease in blood pressure from the normal values that are 120 over 80 mmHg. This decrease in blood pressure can be up to 90 over 60 mmHg. Blood pressure is measured in a systolic and diastolic pressure. Systolic pressure is the measure of pressure in blood vessels when the heart beats between cycles, while diastolic is measured when the heart is at rest. With advancing age, the systolic pressure increases while diastolic pressure increases up to 50 years of age. Then it starts to decline. Similarly, the chances of being hypertensive and hypotensive both increase as the age of a person increases. When the blood pressure of a healthy person falls for a particular time, it is not a serious health complication, unless it is associated with serious signs and symptoms. Inadequate blood supply to the brain, heart, and other vital organs can be fatal. In terms of chronic hypotension, there are chances that a person is taking care of himself as he knows he is a victim of low blood pressure. When there is a sudden fall in blood pressure, it can result in fatal conditions as the brain and heart muscles are deprived of blood and oxygen. In spontaneous hypotension, dizziness and faintness are most obvious. This sudden drop in your blood pressure can occur when you are rising from laying down or you were previously in a sitting position and now you're trying to stand up immediately. This condition is termed as postural hypotension because this is due to a change in posture. A sudden drop in blood pressure could be because of a loss of blood from the body due to bleeding, increased or decreased body temperature, sepsis, a life-threatening condition resulting from combating with infection, heart muscle disease, and anaphylaxis. Postural hypotension is considered to be a failure of the nervous system or cardiovascular system to react appropriately in response to sudden position changes. Another type of hypotension prevails when you are standing for a long period of time. There is an abnormal reflex interaction between your brain and heart. This condition is known as neutrally meditated hypotension. In normal circumstances, when we stand up, our blood is pooled towards our lower extremities. Due to this, there is a drop in blood pressure. But this is compensated by our body as a signal, sending to the heart to beat faster than normal and blood vessels to constrict. Thus, the low blood pressure is stabilized. Now, when this mechanism is not activated for any reason or it is slow in response, a person starts to faint. Blood flow towards the heart and brain reduces in older age. Often this is because of other complications like plaque formation and atherosclerosis, so the precautionary measure is recommended to achieve a balance in blood pressure. There are many underlying causes of hypotension. Among them are genetic reasons, pregnancy, hormonal problems like underactive thyroid, and low blood sugar. Certain medications are taken for the treatment of heart failure. Liver disease and abnormal heart rhythms also contribute to lowering blood pressure. Postural hypotension occurs when a person is dehydrated, suffering from a lack of energy, possibly a lack of food, and extreme fatigue. It is also linked with irregular dietary patterns, medications, and being an addict of drugs. Older adults who are hypertensive take medicines to lower their blood pressure. Sometimes the overdose of these medicines and diuretics results in an extreme drop in blood pressure. Diets high in salt, fluids, and electrolytes are recommended along with medication to treat hypotension. We hope that you are learning something new every day from our videos. If you'd like to know about a specific topic, inbox us, email us, or comment down below.
Okay, that's the material about hypertension to make you more understand, and then we can continue to number 2. Okay, first is number 2A is DACA. Okay, what is hypertension? Okay, thank you, DACA. So, DACA's answer is good, but I will add some of material. So hypertension is characterized by persistently high blood pressure in the systemic arteries. Blood pressure is commonly expressed as the ratio of the systolic blood pressure. That is the pressure that the blood exerts on the arterial walls when the heart contracts, and diastolic blood pressure is the pressure when the heart relaxes, and the blood pressure thresholds that define hypertension depend on the measurement methods, and systolic blood pressure levels, that is over than 110 until 115 millimeter Hg. Several etiologies can underlie hypertension, and hypertension is the most common preventable risk factor for cardiovascular disease, including coronary heart disease, heart failure, stroke, myocardial infarction, atrial fibrillation, and peripheral artery disease. And there are also chronic kidney disease and cognitive impairment, and is the leading single contributor to all-cause death and disability in worldwide. Okay, next we will continue to number 2B. I will choose Arga. Where is Arga? Okay, please. Oh, what cause the hypertension? Okay, Arga, thank you. So, Arga said that the answer is obstructive sleep apnea, kidney disease, adrenal gland tumors, and thyroid problems. And certain defects you are born with congenital in blood vessel as and then birth control cold remedies, decongestants, and over-the-counter pain relievers, and some prescription drugs. Okay, illegal drugs such as cocaine and amphetamine. But I will add Arga's answer is true, it's right, but I will add some of there. I will add risk factors that common in our society. So the first is age. The risk of high blood pressures increase as you age. Until about age 64, high blood pressure is more common in men, and women are more likely to develop high blood pressure after age 65. And then race. High blood pressure is particularly common among people of African heritage, often developing at an earlier age than it does in whites. Serious complications such as stroke, heart attack, and kidney failure also are more common in people of African heritage. And then family history. High blood pressure usually tends to run in families. So if you have a family, if it can be your grandmother or your grandparents or your parents has have a they have hypertension, so you can affect by hypertension too. And then not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction, and the stronger the force on your arteries. Lack of physical activity also increase the risk of being overweight and being overweight or obese. The more you weigh, the more your blood need to supply oxygen and nutrients to your tissue. As the amount of blood flow through your blood vessels increase, so does the pressure on your artery walls. And then using tobacco. Not only smoking or chewing tobacco immediately raise your blood pressure temporarily, but the chemicals in tobacco can damage the lining of your artery. Secondhand smoke can increase your heart disease risk. And then too much salt or sodium in your diet. Too much sodium in your diet can cause your body to retain fluid, which can increase blood pressure. And then drinking too much alcohol. Over time, heavy drinking can damage your heart. Having more than one drink a day for women and more than 2 drinks a day for men may affect your blood pressure. If you drink alcohol, do so in moderation. And for healthy adults, that means up to the drink a day for women and 2 drinks a day for men. 1 drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounce of 80 proof liquor. If you if, if you drink alcohol, but I think there are not so many people in our class that drink alcohol, right? Okay, and I will add some. There are stress too, and high level of stress can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco, or drinking alcohol can lead to further increase in blood pressure. Okay, that's the cause the the hypertension. Okay, for the next, we will continue to the last question, which that I think favor. Okay, please favor the treatment for hypertension. Okay, okay. Thank you, favor. That's right. We can use oros for hypertension. So, oros is osmotic console release oral delivery system. It is an advanced drug delivery technology that uses osmotic pressure as the driving force to deliver pharmacotherapy in many therapeutic areas. Over the past decades, different oros osmotic dosage forms have been studied to optimize extended release oral administration by controlling the rate of drug release, providing different delivery profiles. Oros has been recently introduced in clinical practice for treating patients with chronic cancer and non-cancer pain. And oros ensure a constant monophasic delivery of hydromorphone over a 24-hour period. The pharmacokinetic profile of oros is minimally affected by food and alcohol. Okay, to make you more understand, we can watch another video about hypertension.
High blood pressure, or hypertension, is a common condition in which the force of blood on the walls of your arteries is often too high. Arteries are the blood vessels that carry blood away from your heart to supply your tissues with oxygen and nutrients. In your heart, two chambers, called ventricles, contract with each heartbeat to push blood to your lungs and through your arteries to your body. As blood flows through them, three main factors affect the pressure on your artery walls. The first is cardiac output, or the amount of blood your ventricles push out of your heart each minute. Your blood pressure goes up as cardiac output increases. The second factor affecting your blood pressure is blood volume, or the total amount of blood in your body. Blood pressure also goes up as blood volume increases. The third factor that affects your blood pressure is resistance, which is anything working against the blood flow through your arteries. Several factors contribute to resistance. One resistance factor is the flexibility of your artery wall. Healthy arteries expand with each heartbeat to help reduce blood pressure on the wall. Another resistance factor is the diameter of your arteries. Your body is able to increase the diameter of your arteries to lower your blood pressure, or reduce the diameter to raise your blood pressure. A third resistance factor is blood viscosity, or thickness. In your blood, more particles, such as proteins and fat, increase viscosity. If your blood is thicker, your blood pressure goes up as your heart works harder to push it through your arteries. Your blood pressure can be measured with a device called a sphygmomanometer, or blood pressure cuff. When your heart beats, the pressure of blood on the walls of your arteries is called systolic pressure. When your heart relaxes between beats, pressure on the artery wall is called diastolic pressure. While your blood pressure may change throughout the day, it should normally be less than 120 millimeters of mercury for systolic pressure and less than 80 millimeters of mercury for diastolic pressure. If your systolic pressure frequently stays above 140 or your diastolic pressure frequently stays above 90, you have high blood pressure. Over time, high blood pressure will damage the walls of your arteries. Your artery wall may become weak and form an enlargement called an aneurysm, or the wall may burst and bleed into the surrounding tissue. Small tears in your artery wall may attract certain substances in your blood, such as cholesterol, fat, and calcium, to form a buildup called a plaque. Blood flow through your artery decreases as the plaque enlarges. Blood cells can stick to the plaque and form solid clumps called clots, further reducing or completely blocking your blood flow. Damage to your arteries raises your blood pressure even more by making your heart beat more forcefully. Artery damage and reduced blood flow lead to conditions such as a stroke, heart attack, or kidney disease. In most cases, the cause of high blood pressure or hypertension is unknown. This type of high blood pressure is called primary or essential hypertension. Treatment for essential hypertension includes lifestyle changes, such as eating a healthy diet. If you are sensitive to the sodium in salt, your doctor may recommend limiting your intake of salt and highly processed foods. Sodium may cause your body to retain water, which increases both your blood volume and your blood pressure. Other lifestyle changes that can reduce blood pressure include avoiding excessive alcohol intake, getting regular exercise, losing weight if you are overweight, and quitting smoking. Your doctor may also recommend medications that act on your kidneys, blood vessels, or heart to help reduce your blood pressure.
Okay, I think it's enough. And enough for today. Okay, thank you for today. So next time I will give you tasks. You have talked about two blood disorders in circulatory systems, but there are the other four. So you must make a poster. Choose one of four in one group, one poster, and one topic. It can anemia, hemophilia, thalassemia, or leukemia. And then the content of the poster is to analyze the symptoms, how to treatment, and what's technology that can be a treatment for this for these disorders. And then don't forget to upload it on your social media. Okay, enough for today, and see you next week. Don't forget to do the task. Okay, good morning everyone. Okay, thank you.